Thank you, Megan. Yeah, waiting on the cooler air. Same here. I know. Texas is such a tease. Not fair, not fair. It'll come and then we'll all be miserable. So, that's how Texas goes. Almost Friday. Yes. I'm feeling that. That's right. Tomorrow's Veterans Day. I think not everybody gets to take that day off. So if you do get to take it off, then, enjoy it for the rest of us. All right, so it's 11:35, and so we can go ahead and get started. I want to thank everybody for attending today and taking time out of your busy schedules. I've been really looking forward to this meeting. We've got some really juicy things on the agenda, and it's the last meeting, our last official meeting of 2023. So from now on, we get to really look forward to all kinds of different initiatives and growth for the coalition that we'll be discussing for 2024. So that's always really exciting. So let me take a look at the agenda real quick. And
Nina, while you get that pulled up, I would just ask everyone if you don't mind adding your name and your organization to the chat so I can take a little attendance and know who's in the room.
Thank you. All right. Here we go. Go away. All right, so just a quick overview of today's agenda. We will have our long anticipated presentation. Today we have Liz McCormick and Adam White from United Way of Greater Austin, who's going to be giving us a lot of the details and information on the Help Me Grow expansion into Hays and Caldwell counties, but overall into Central Texas. So that'll be very exciting. I have the results of our 2024 coalition planning survey, and so we'll go over some of the that information, and then I've got a list of ideas and things that will be starting for the 2024 year, and definitely want to hear feedback from everybody about those things. I'll do a quick review over a little bit, a tiny bit, not very much information about the PDG Birth to Five Needs Assessment, which is really great information. And then, as always, we'll be discussing the Bright by Text dashboard, community partner agreements, and then have a little bit of time at the end for community announcements. So we definitely want to hear from everybody at that time. So for right now, what I'm going to do, and I'm sorry, I did not introduce us. I just always imagine that everyone knows who we are. My name is Nina Linda Ramos. I am the Early Childhood Coalition Coordinator with Community Action. We are serving Hays and Caldwell County. And on the other line is Megan Campbell. She is our home visiting director, and she will be fielding all the chat stuff and everything. So if I don't see something, she will definitely get to it. Megan, is there anything else that you want to add?
Nope. Good morning. Good to see you all.
Cool. Awesome. So in that case, I'm going to stop sharing my screen. And Liz, I'm going to allow you to go ahead and share.
Yeah. Oh, I think you need to give me permission to share.
Okay, let's see here. All right. Can you share now?
Yes, I can. Thank you. There we go. All right. Hi, everybody. Can everybody see that screen okay? Okay, like Nina said, thank you so much, Nina, for the introduction. I am a community integration coordinator on the Connect ATX team at United Way. My role has a focus on the early childhood sector, and the main responsibilities of my role right now are working and building relationships with organizations in the early childhood sector, and supporting their usage of Connect ATX. And for those of you who are unfamiliar with Connect ATX, I will go over what it is in just a little bit. And so I'm going to give an overview of what Help Me Grow is as a system model, and then dive a little deeper into our merge and us as Help Me Grow Central Texas now, and what that means moving forward. So if you have any questions, please feel free to put them in the chat. And then at the end of the presentation, Adam or myself can answer some of those questions you might have. So first, I just want to give a little bit of overview of what Help Me Grow is. It is a system model that utilizes and builds on existing resources in order to develop and enhance a comprehensive approach to early childhood system building. So it is not a standalone program, but it is an added layer of support and structure related to existing entities for a very specific population. So our early childhood friends and families. As an initiative, it does take an aim to support the parents and caregivers with resources that can support the young children. And we really have an emphasis on children who might be at risk for developmental delays. And so basically, to put it practically, it's working on several projects to help strengthen the grid of existing resources. And we really do that by building relationships and developing some tools for the community as well. So Help Me Grow does have 4 main core components. So I'm going to go over what those 4 components are, and then I'll break down the work that's already being done in those components, and then the future work that we'll be doing together in those components. So the first one is our centralized access point. Oops, I'm sorry. There we go. And the point of that is to assist families and professionals in connecting children to the grid of community resources, with the goal to help them thrive. The next component is our family and community outreach component. And what that does is it helps to build parent and provider understanding of what healthy child development is, what services are available in the community to families, and then how both of those pieces are really important to improving children's outcomes. The third component is our child health provider outreach. And the goal for this component is to support early detection and intervention efforts. And there's also a piece of that that really connects medical providers to the grid of community resources, with the goal to best support our families. The fourth one is our data collection and analysis component, and that is to support evaluation. And it also helps us to identify systemic gaps, really build up advocacy efforts, and guide quality improvement. So taking all of that, that is Help Me Grow as a whole at the national level. And now we are all now Help Me Grow Central Texas, which is really super cool and exciting. And so what that means is it's an initiative to support families with young children to get the access to services and resources that they need to help them thrive. And so there is the vision that every child has their development supported to be school ready by kindergarten. And the mission of Help Me Grow Central Texas is to equip families with access to the resources and services needed to support the healthy development of their child. Excuse me. Priority population, of course, is our early childhood friends, so families with children, and that includes the prenatal phase through their 5th birthday, so all the way up until the day of their 6th birthday. So looking at those 4 components a little bit more closely and more specifically to the Help Me Grow Central Texas work, as I mentioned, there's Connect ATX. It is our online platform And it was launched in early 2020 with the goal to really be a source for specific resources. There were like 5 categories only at that time that they had a goal of really having resources for. And then when the pandemic started, it became a main access point in the state of Texas for resources, as well as during the big winter storm that we had. And so it's really become a vital piece in our resource connection to the community. And it also is a community tool that really connects peoples and programs to services. And the services that are listed on Connect ATX are free or reduced cost, and they can provide support for food needs, transportation needs, healthcare needs. And we do have a section on there specifically for parenting and early childhood. So they can easily find those resources as well. It's also a closed loop referral system. And so what that means is that it allows organizations to receive referrals directly from the community. And so that means that anybody can send a referral through Connect ATX to an organization that chooses to receive those referrals through the platform. So you could have a community member referring themselves to a program, or if they're working with a case manager or getting support from another organization, referrals can be sent directly through Connect ATX to another organization. And so we've created the network of organizations that we support their usage of it, and they use it in a variety of ways. So there are some that use it as a full-blown case management tool. And while it is not as robust as an actual case management tool, it does work really well for a lot of organizations. There are some that do use it as their case management tool. And then there are some that just choose to have their programs and services listed, but receiving referrals through the platform just may not make sense for that organization. So there's a variety of ways that it is used, and the goal is really just to better serve our families and the communities. Some of the features of Connect ATX are that an organization can choose to have some or all of their programs listed on there. And a staff member of the organization can do what we call claim the programs. So they're going to take ownership of it. And then we work really closely with them to keep the information up to date. Organizations, like I said, they can choose to receive referrals through the platform directly from the community if they'd like. We have 3 different referral tools that they can choose to use. So that's from basic information, just name, phone number, and email address, all the way to being able to actually schedule appointments with that organization through the platform. So they do have a variety of tools to use. And then it's the main piece of it is to search for resources and refer clients out, or as I said, a community member can refer themselves as well. It gives organizations the ability to respond and update referral statuses. And so part of the closed loop referral piece is that partners who choose to have a referral tool turn on, we work with them to update statuses on those referrals so that the person who sent the referral can know what's going on. Was the person contacted? Were they eligible for services? Did they get help? And so that also helps the organization that's sending the referral know and understand how their clients are being served. Again, as I said, it can be used as a client or case management system. It won't replace, like I said, any of those really big and detailed case management systems, but it does work well for some organizations. And then a really cool thing that it does is there is an analytics option that they can access data, so they can really see the impact that the program's having on the community. And many organizations use that information for funding purposes, to report to grants, to apply for grants, and they find it really helpful. Some support services that United Way has in place for Connect ATX. There are 4 main teams that that support the platform. The community engagement team is the team that I'm on, and they are ready to support the organization's work, our philosophy is meet the organization where they're at. So if they have a referral process already in place and it works really well for them, we support them in that, and we work with them to keep information up to date. And we also can work with organizations to develop a workflow process so that they can create the appropriate processes to receive referrals and follow up on them and what that would look like for their specific organization. We also have the community information team, and they work really hard with our organizations to update the database so that all of the information is accurate and up to date. We have heard so many people say that when they send referrals on websites or through other platforms, that their biggest challenge is that that information often is not up to date. So we have a team dedicated just to keeping that information up to date, and they do a really great job at it. And we also have a navigation team. So Connect ATX, although you can use it to search yourself, if there are people who might need some support navigating on the platform, they can either text or chat online with a navigator who can walk them through the process of searching for resources, or give them support by helping them find those resources and referring on their behalf. And then finally, we have the data and evaluation team. And so they work really hard and closely with the data, and they can provide partners access to a variety of data. And so looking at how all of this makes sense for Help Me Grow Central Texas, there is a work plan for each year. So we are currently in the process of implementing the work plan for year 2. And so I'm going to share the goals that we have and how they really relate to each component and the work that we're going to do in it. So the first one is for the centralized access point. And so the goal is that the access point is implemented with accurate, up-to-date resource information and the ability to follow up with callers in multiple modes to ensure the highest success rate possible. And so while we already have Connect ATX up and running and it's been doing really well, there is the goal to rebrand from Connect ATX to Connect CTX to make it inclusive of the entire Central Texas region. We already own the domain to have it switched to connectctx.org. And I don't have a firm date of when that will be done, but we do know that it will be done in 2024. So we'll keep y'all updated of when that happens, and that'll be super exciting. And so then also with that goal, we'll work together to explore the best opportunities and organizations in the Hays and Caldwell Counties region for outreach, as well as working with the community to ensure that early childhood resources are represented on Connect ATX within Hays and Caldwell counties. For the second component for family and community outreach, this is where the coalitions come into play. And so there is the Austin Travis County Success by 6 Coalition, and then you all here at the Start Smart Coalition. The Success by 6 Coalition has a long-term goal to ensure that children are happy, healthy, and ready to succeed in school and in life in their first 2,000 days. And so the way that Success by 6 is set up is it's a 4-pillar framework. And the 4 pillars are healthy beginnings, supported families, high quality care and education, and safe and stimulating communities. And each of those pillars has a work group that coalition members can join, and then they have individual tasks and goals that they're working towards in those work groups. And then the Start Smart Coalition, you all similarly focus on kindergarten readiness. And then Nina shared that you all are working on some workforce support and development. And so that's really cool. And so those are all definitely pieces of the Help Me Grow model that are super important. The goal related to this component is to provide outreach to increase awareness of Help Me Grow at least twice a year. And so the ways for us to do that together as Help Me Grow Central Texas is to offer workshops to you all here in your coalition to provide insight into the work of Help Me Grow. And then also the work of it within Connect ATX, and then also providing quarterly workshops on Help Me Grow development within Central Texas. Moving on to the next one. Our next one is for child health provider outreach. Two things that we are focusing on. We have a physician champion that we have partnered with, and then also engaging in Learn the Signs Act early, so that the early detection of developmental screenings. And so to give a little bit more about that, the physician champion, we have partnered with Dr. John Hellerstedt, who is formerly the Texas State Health Commissioner. And so he's working with us, and his purpose is to begin building awareness of United Way's Help Me Grow initiative among potential partners in Austin Travis County, and to help support the Help Me Grow team to create strategies to build robust relationships between the early childhood ecosystem and the pediatric system of care. And so we're working with him. He's really giving us insight onto how to best provide outreach to the healthcare providers and really get them engaged in this work, and sharing resources with families as well. And then for Learn the Signs Act Early, again, it's to really get the word out there as much as possible for developmental screenings and early detection of those developmental delays. The goal that we have in place for this component is for Help Me Grow staff to conduct targeted outreach to child healthcare providers, doing that through office-based education, training, and/or workshops about effective developmental screenings and surveillance. And so some of those things for us to do together moving forward is one of our goals is to really increase the use of the Help Me Grow centralized access point among federally qualified health clinics. So really getting Connect ATX, soon to be rebranded Connect CTX, out to those health clinics that are designated as federally qualified health clinics. Also to curate resources to support the child healthcare providers in promotion and follow-up of developmental screenings and surveillance. So this is where promoting also Learn the Signs Act Early comes into play. And then establishing a work group with child healthcare providers and parents so that we can collaborate on various developmental screenings and surveillance. And then the final piece for the data and evaluation, we are working on internal and external dashboards to be able to utilize the data that we collect to inform internal work and remain innovative. Also to be able to identify trends in the community, and that will allow us to better serve our families. And so for that, like I said, we're in the process of creating internal and external dashboards. And the goal for it is to use those dashboards to support the use of the Help Me Grow data in identifying trends and creating action plans to support in improving, changing, and sustaining trends. And so really the hope for that is to operationalize the United Way data and evaluation system that already exists, and to use that within the Help Me Grow Central Texas expansion. And then also to work together to identify a reporting system in collaboration with you all, and to work on reporting to the appropriate funders. And so that is Help Me Grow in a nutshell, and the work that we'll be doing together. And it's really exciting to have merged and expanded to the Central Texas region, because the support for our early childhood sector is so necessary. And so it's really exciting to join together with everybody. Any questions or comments, concerns? Okay. Well, you can always reach out to myself or Adam if you do have any questions or concerns, or just want to talk a little bit more about it. And just super excited for moving forward together in this initiative.
Awesome. Thank you so much, Liz. I had a couple of, some of the questions that I have been sort of fielding that were really general questions. And I think one of those was people were sort of concerned about this being a duplication of Unite Us, which I know is very different, but I don't know if you could maybe speak just a little bit to the differences in those platforms.
Yeah, Adam, could you speak on that? I don't have the.
Hey, sure. First of all, good morning, everybody. I'm Adam White. I am the Regional Director for Help Me Grow Central Texas. So I support the work that we're doing in Austin, Travis County. Super pumped to support the work that we're now doing in Hayes and Caldwell. And I see my dear friend Denise is online, and I support the work that they're doing in Wilco. So super happy to be here. In regards to the question, I'm not completely familiar with Unite Us, but if I am speaking to the platform of Help Me Grow and what that is, it's not necessarily like a program that we're implementing, but it is a model in which we work together to synthesize the work that's already happening. So a part of our goal within Help Me Grow is to look at, are we doing anything that's duplicative or the same? And if we are, how can we change or modify that so everyone has a specific role within this framework that we're doing? So Help Me Grow, the idea of it is more sort of like a project-based model in which we're taking the work that's happening in we're taking the work that's happening in Austin, Travis. We're taking the work that's happening in Wilco, and we're saying, how can we augment or modify or redefine or substitute existing resources to fit what the community needs? And then we're going back and saying, all right, based on how we did that, let's look at our data and our trends to determine, were those methods effective? Did they really support the community? Are they creating more gaps? Are they eliminating more gaps? And if it is working, how can we make it innovative because time continues to change? And if it's not working, what steps can we take based off of community feedback and what we're gathering from data to then improve that within those 4 components? Does that answer your question, Nina, or am I off?
Yeah, I think a lot of and I am only speaking to the questions that I've been receiving as I've been presenting this to the community. Unite Us being this platform for providers to be able to use that for referrals. It's an inward facing referral system. So yes, I think that does really speak to that because I think some of the concern has been exactly that. Like, is this going to be a duplicative effort? And so knowing that those marks are in place, those benchmarks are in place, is going to be very helpful moving forward.
Yeah, I think that's a great, yeah. Now that I'm understanding what you're saying about the Unite Us, yeah, Help Me Grow doesn't actually have, it's almost like anyone that's iPhone familiar, it's like an iCloud. It doesn't really have anything that's in it. Like we don't have, it doesn't have a referral system. It works to improve whatever system people are using for referrals or for developmental screenings or for data and evaluation by saying, hey, here's some funding, here's some community resources, here's a national center, and you can use all of this in conjunction together to determine how you can better serve the community that you're in.
Yeah. Awesome. And I know that I'm really looking forward to seeing how getting that data back and sort of as a coalition, definitely, but just our individual programs being able to utilize that to really identify gaps and address them. So I'm really stoked. Does anyone else have any thoughts, comments, concerns, questions about Help Me Grow and sort of where we are in this process, or just Help Me Grow in general? Awesome. Awesome, guys. Well, thank you so much for the presentation. I really appreciate it. I know you guys are busy, so if you're more than welcome to join us for the rest of our meeting, but if you need to hop off, I also totally understand. So thank you.
Thanks,
And
Lily.
yeah. All right. Mhm. One moment while I get my screen share on. Okay. All right. So we are moving on to the 2024 Coalition Planning Survey results. We had about 10 people that participated in this survey. And give me 1 second. I have things. I have too many screens on and it's confusing me. There we go. Here. There it is. Okay, there we are. It's the deal with multiple screens is that they get confusing. Some of the key questions that we, well, let's start with our goal. Our goal for implementing this survey in the first place, right, was our wonderful steering committee wanted to get a pulse on our coalition wants and needs. Like I've been, we've been discussing the last couple of meetings and through email. We're really looking forward to a lot of the new opportunity that we have with this coalition with increased funding and support. And so we're really looking forward to taking on additional initiatives and also really strengthening our partnerships through shared actions. Which is really important to strengthening and making this an effective coalition. So one of the key questions we had was, which initiatives are you most interested in participating? So professional development obviously was one of those key initiatives there, followed up by community events, and then also networking and project work groups. So that professional development piece is something that has really been speaking to folks. And I think it's important to also state here that, when we talk about professional development, we are talking about not just for our own team on this coalition, but also offering professional development outside of this coalition, and specifically for the early childhood educator workforce that we know has been really difficult to support because we have meetings at 11:30 on a Thursday. So that has been a big focus of ours. One of the next questions we asked and is about professional development and what types of professional development you're most interested in. Child development and family systems were definitely the largest wants for professional development amongst the coalition. And I think that makes sense. We are coming from all different types of spaces. Some of us work direct with families, some of us don't, some of us are in supervision, other of us, do program implementation and planning. So it looks a little different for everybody. So I think definitely something moving forward is really focusing on providing those child development specific PD opportunities. After that was networking and collective impact, wanting to know more about how we can strengthen this coalition and what collective impact is. Collective impact is a big sort of buzzword lately right now. And so, Megan and I are definitely taking steps to become more pros at this, more experts on collective impact so that we can pass along some of that information. Followed up by legislative updates and advocacy. That's something that I think that we're all very excited about. And I think moving forward in 2024, in order to address this, one of our standing agenda items can be legislative updates and advocacy opportunities that we can participate in just individually as providers or as a coalition. So what we can do to support our own work in a larger way. And then following that, management and supervision and data and information from local providers. Management and supervision, we definitely want to support folks in providing quality supervision for their teams. So that's something to think about. And then data and info from local providers. What it looks like to be getting more presentations and more really in-depth information from our partners here in the coalition about what services they're providing, what are the constraints of their services, what can we do as community partners to work together to strengthen each other's programs. I think all of that really starts with just learning about and understanding more about each and every individual's program, and also understanding what data we're all collecting. I think that is definitely a wonderful opportunity we have to share, the data that we're already required to collect. I know I've talked to a few people about this before, and then being able to share that data with the coalition as a whole, so that we can all benefit from the work that we're already doing and the data that we're already collecting. And that's definitely where folks on this call come in. As always, I would love to hear from people about presenting about their programs and learning more. I know lots of us take for granted that we know these things, but we're always having turnover, always seeing new faces at these meetings. So definitely take the opportunity and reach out to Megan or I and to share this information. And then we moved on to ideas for networking and community events. And I specifically, dream big, right? We definitely want to dream big, because if we have to, we can always par it down. But I know a lot of us have a lot of really, really great ideas, and I really want to see a lot of these come to fruition. So these were a couple of the responses that were shared. Monthly parent meetings and trainings at El Centro, which is a wonderful venue for things, and they have early childhood events there, and lots of family support events, and so definitely would love to connect with them more. More parent involvement, yes, absolutely. We're going to talk about that in just a minute. Early childhood teacher training conference, which is a wonderful idea. And I think that goes back to what I was saying before, that we really want to tap into that population in particular and provide professional development, and then hosting a baby day event. So this is some of the things that we have been discussing as activities and initiatives for 2024. And I would really, really love to hear from folks on this call about any additional ideas, or how you're feeling about these particular ideas. We're, like I said, we're dreaming big, and I feel like this is all very possible for 2024. It's a lot of work. We'll be putting in a lot of wanting a lot of feedback and participation from the coalition. But some of the different ideas that I think addressed some of those wants and desires from the survey were, like we discussed before, community developmental screening events. And that is something that we're looking at, having a space, being able to provide stipends for providers to have, employees to come out to assist with these, so that we have experts on hand, completing ASQs with families, and, partnering with families really to help them observe their children, and providing real-time feedback to families about their child's development. This is a great opportunity for families who aren't ready to commit to a long-term program, or who just have questions, or who just want to learn more about their child's development. And I'm really hoping to be able to implement these in Hays and Caldwell counties. the Baby Day event happening in April, which I'm sure Alex can speak to a little bit better, being the expert. We're definitely planning on, as a coalition, hosting a Baby Day event. And Alex, do you want to add to any of that?
Yeah, I would love to. Hi, everybody. I'm the Director of Awareness for First 3 Years, which is a statewide organization, and I do statewide work, but I just so happen to live in San Marcos. So Baby Day is the signature event of First 3 Years that we use to really build awareness around early relational health. And especially emphasize that those intentional daily interactions between parent and infant toddler are kind of the secret sauce to early relational health. And y'all might be familiar with Baby Day events that you've heard of in the past. First 3 Years as an organization has the bulk of our staff up in the Dallas-Fort Worth area and then down in Houston. And so we will be directly hosting, First 3 Years will be directly hosting events in Dallas, Fort Worth, and Houston, as well as Baytown, which is just south of Houston. But for the first time ever, officially and with pride, we are working with community-based hosts, just like Community Action in Central Texas and Start Smart Hayes and Caldwell, to host their own Baby Day events in their community. And we'll be providing a toolkit of resources and hopefully a little bit of money to make the event successful. The thing that I'm most proud of is that we have come up with the activities for the Baby Day event ourselves, with the intention of ensuring that each of the events has some kind of early relational health component built into it, so that our hosting organizations don't have to even think about that part. So we'll ensure that there are activities that focus on gross motor skills, fine motor skills, cognitive development, you name it. But with every single one of those activities, we're going to have really explicit language for both the facilitator and for the family about why this particular activity supports early relational health. And for us, that's, the huge takeaway. We want parents to kind of walk away with that knowledge that, these everyday interactions are where we're building that early relational health. Yeah, that's kind of the biggest piece of it. Again, I'm really lucky because I do happen to live here in San Marcos, that I will be a part of this local Baby Day event, while also probably supporting day of activities at the events across the state. But so far with this new approach of working with community-based hosts, we have some pretty far-flung folks that are joining the Baby Day world, including all the way out in El Paso. So there's going to be a Baby Day in El Paso this year, which I'm very excited about. And we're trying to get more of our rural communities on board with hosting kind of smaller Baby Day events. But I could go on and on. If you have questions about Baby Day, put it in the chat. I'll put my email in there, or you can ask away. But yeah, Baby Day, end of April.
Yes. And so to that end, you will definitely be hearing more about Baby Day as we will be sending out information and making sure that anyone who wants to participate is able to participate. And if you need resources in order to participate, that you're getting that support as well. Also on our list of initiatives is a springtime networking event that we'll be discussing later on, or early in the year, not later on today, but in another meeting. Also, parent advisory committee developments. I think that we've all discussed and are very excited to really engage parents in a more meaningful way, not just on our own as providers and programs, but most definitely just in the early childhood space and in this coalition. So we are looking forward to developing a parent focus group and then really determining what it is that parents are looking for as far as engagement. We don't want to assume that they want to have a parent advisory committee. Perhaps there are other ideas or other ways that they want to be involved, and we want to hear from them. So those are things that we're looking for ideas on. Like we mentioned before, monthly professional development opportunities for early childhood educators. and adoption of little free libraries. In order to really support literacy efforts in Hays and Caldwell counties, we are looking for ways to adopt little free libraries and really make this a grassroots effort by the coalition to fill those libraries and keep them filled with books that encompass learning and diversity and inclusion and all those wonderful things that we want littles to have access to. So with that being said, those are sort of the ideas that we're going to be taking with us into 2024. And it's really just a starting point. Does anyone have any thoughts or comments or additional suggestions?
I just want to throw out there, hello everyone, Community Action as the backbone organization for this coalition has received funding to support specifically coalition initiatives, like the ones that are outlined here. So when we talk about dreaming big, I just really want to put an invitation out there that we have money for community-wide initiatives. And even more money. Our funder just told us that they want to give us even more money than they've already. So we have opportunity to really think big. So I just want to put that out there, that we really are welcoming of your thoughts. Yeah.
Awesome. Anybody else have any thoughts on this? Cool. And thank you, Megan. Yes, it's part of sort of our excitement and also the daunting task of being sure that we are using these resources and that we want to be sure that we are sharing the resources we have with you guys, with the providers, with the members of this coalition. This is a shared this is a shared journey amongst us, and we definitely don't want to gatekeep anything, or so if you have other ideas or questions about these resources going forward, please feel free to reach out to us at any time. So just looking forward to our January 2024 meeting. These are the things that we're really looking forward to honing in on, those initiatives and any other ones that we can come up with that we think would be effective. So discussing the coalition vision and goals, we want to be sure that everybody is on board with our vision and goals. And are we feeling good about it? Do we feel like we need to amend it? These visions and goals were created 8 years ago. And that was pre-COVID and things changed. So we want to make sure that we're not staying stagnant and that we're really, staying current, that we're going to review some of those planned coalition activities and really discuss what it looks like for us to collaborate, and creation of project work groups. Liz was mentioning some of those earlier. We definitely want, a lot of these activities are a big part of the community outreach. And so what it looks like to have project work groups so that this is a functioning and well-oiled coalition going into 2024. So with all that being said, and I'm just going to take a brief moment with this. Let me see what time it is. Perfect. We are good. So something that Alex shared with us at the steering committee meeting last month was the Texas Early Learning Council's preschool development grant birth to 5 needs assessment. You may have received emails about this over the past couple of months, asking you to participate in surveys or asking you to share surveys with your workforce, with your staff. And so this has been a long time coming, and they shared the initial findings of this assessment to the Texas Early Learning Council. The initial findings were shared over 3 different presentations to the Texas Early Learning Council. The first was focused on early childhood workforce. The second was about early childhood coalitions. And the third focused on family needs and data systems. And it's quite a bit of information, and I didn't want to put too much here because I didn't want you know, I wasn't sure how much time we had, and it was already a stacked meeting. I didn't want to overdo it, but you know, as Alex said, right, we could have talked about it forever. But I will be sharing the link to this and you know, in the follow-up email. And I really encourage you that when you have time to view them and look through them, I think it'll really be helpful as we move into 2024 to get a grasp of where the state is and where we are already when it comes to the early childhood sector. It'll really you know, inspire some ideas. I know that it did for me to you know, go through these and also validate some of the things that you're seeing in your own program and with the families that you work with, that these are all shared experiences and challenges that we're having. I tried to keep it, my vision was that I would keep it to a page, but that felt impossible to me. But I did create a quick notes, you know, from the notes that I took that I'm going to be sharing in the follow-up email for this meeting, so that you'll have something that you can review to give you an idea about what the topics that are being discussed, and just some of the basic data that I thought was really relevant to share. So I will be sharing that with you guys in the email. It'll be in a Word document so that you can add to it, you know, or change things as you would like as you're viewing the videos on your own. But I highly recommend that everybody take a little bit of time, and I think it'll really, as a coalition, you know, all put us on the same page about the needs that we would like to meet and what the gaps are in our community as far as moving forward and supporting these different sectors of workforce and building this coalition up. One of the things I wanted to show here was the training wants and needs that were across all sectors. So as part of this needs assessment, they interviewed early childhood educators, childcare directors, both large center directors and, you know, smaller scale at-home center directors, and home visitors and home visiting supervisors. And across the board, and these are in order of importance, you know, the training needs that were really identified were addressing challenging behaviors. You know, as you all know, there has been an increase in challenging behaviors in early childhood, you know, especially in childcare settings. And a lot of the providers do not feel adequately trained or prepared to address a lot of the aggression or, you know, discussing potential developmental delays or disabilities with parents. They really don't know where their place is in that, and they feel that they're not getting the appropriate training and support to do it. So instead, it's not happening at all. So that is one of the #1 key training needs. The next is child growth and development, just general growth and development. Responsive interactions and guidance. So how do we intervene with children, you know, and how do we guide them, and also with parents, and then supporting children with special needs. So these in particular are really highly needed areas. And so once again, if you feel that you're in a place that you can provide information or present or share for this, please reach out to us, because we'll be planning these professional development opportunities out. Hopefully, our goal is to have monthly professional development opportunities for early childhood educators, specifically in after-hours settings. So most likely virtual. So if that sounds like something that you feel that you can provide, you know, or that, you know, you can support, we would love to hear from you. Does anyone have any thoughts or comments on that before I move on? You sound a little digitized. Hi, Marcia.
Uh-oh. Or not really.
Oh, you sound like real staticky.
Like, uh-oh, it could be the headset. Let me see if I could. take it off. If not, I'll put it in the chat.
It's
Okay,
getting
I heard it
better.
now. It's getting better?
Yeah, I can hear you. You got a little static, but I can definitely make your words out now.
Okay, and I'll cover, ooh, I feel like this sounds better. Does it sound better? Like it's
A
closer to
little
my
bit.
mouth?
Yes.
Maybe not. Okay. Okay, I'm gonna leave it there. All I really wanted to say is maybe for the support children with special needs, I'd be happy to connect with the Office of Disability Services here at Texas State. They don't necessarily work with children, but to give parents who maybe are finding challenges with their kids and not really seeing what this could look like in the future, to see and know that there are a lot of folks that the university supports, and there are children who grew up to teenagers who are now in college and supporting themselves, and maybe, you know, that maybe if there's like a panel or something and they could be a part of that, I'd be happy to reach out to them once the time gets closer to see if that's something they might be able to provide any support with.
That would be absolutely wonderful. You know, I would love to hear more about that. And then also, you know, if there's a key person there that you feel might be appropriate to be attending these meetings, you know, let's involve them. That sounds
Okay.
Yeah, that sounds like a really wonderful idea. Thank you, Marcia.
You're welcome.
Awesome. Any other thoughts or comments? I see that Prop 2 passed. Woo woo! Thank you, Alex, for that update. So if you're not familiar with Prop 2, which I hope you are, because we all should have gone to vote, then you know that Prop 2 provides property tax exemptions for child care centers. So that's very exciting. Am I missing anything with Prop 2? That's the basics, yeah.
Yeah. You got the broad strokes, the stuff that really matters.
Yeah. Yeah.
Specifically for childcare centers that are part of Texas Rising Star, which is really that emphasis then on quality. So quality rated centers are going to have an opportunity if a local jurisdiction decides to go ahead and exempt them from property taxes.
Okay. Thank you for that. And also, you know, so it sounds like there's still a possibility of a barrier depending on that jurisdiction. So yes. Oh, politics now. Thank you. So moving on, just a quick Bright by Text overview. For those of you who are new to this meeting, Community Action is the proud holder of a Bright by Text license. Bright by Text is a messaging application that parents and families sign up for. They put information about their child, just basic age, into it, and then they get you know, a couple of text messages a week that are specific to their child's development for that age. You know, I have my kiddos are older now, so I put in a fake baby. So I get messages every now and again on, you know, what it is to check in on kiddos' hearing, eyesight, or opportunities. One of the ones I received recently was really neat. It was basically how to use a box to play with your baby. And I really loved it because it just goes, it's very simple. And I followed it through and sort of watched it, and it was really neat. So one of the things that we're also able to do on this app is that we're able to put community messages on there, which is, I think, something that's the most valuable as far as our, you know, locality goes. So if you have messages that you would like to get out to the community of parents of children birth, it goes from prenatal to 8, I want to say. Yes, from prenatal to 8 years old. So if you have, you know, anything that's free, opportunities for events, trainings, you know, parent connections, anything like that you want to share with a specific population, you can share that information with us. And I'm going to show you how in a minute if you don't already know. So currently across Hays and Caldwell County, we have 431 active accounts. That includes 547 children. And I'm feeling really good about that because that is definitely, we're growing. It's definitely an increase. So I'm feeling very optimistic about that. This is some information on sign up activity. and unsubscribed. So it looks like October was a big explosion, I would say, of signups, which is wonderful. And then, you know, we had a couple of people who, for whatever reason, they go ahead and stop services because they just don't want any more text messages. I can totally feel that. I get it. Or they just didn't follow through with the sign up. So the last one that we had was Greater San Marcos Youth Council Community Bingo. That was sent out on October 23rd. The number of recipients that received it was 173. And I believe that, and Megan, you can let me know, was this message made for like a particular population or just overall?
Yes, it was, and actually, I apologize, I didn't update the message title. This was actually about Greater San Marcos Youth Council's Haunted Hallway. So I didn't update the title, but yes, you can tell by the number of recipients that it was exclusive to a certain age group. They didn't include the little babies to go to a haunted hallway event, which makes sense. Right, and so if it included all of our recipients, then it would be in that 400 number that we had listed before. So when you complete the community message request form, you have the option to select age groups or zip code. I don't remember super specifically if they narrowed it down to region by zip code, but I do know that it was by age. So that's why you only see 173 instead of that 431 number there.
Yeah, perfect. And then so we had 14, yes, awesome. We had 14 that clicked on the URL, 8% that and with an 8% click-through rate. So that's pretty good. And it looks low, but it is definitely growing. For those of you who are new to these meetings, this is definitely a growing response, I believe, to this messaging service. And Laura mentioned, yes, for Hays County only. Thank you for that clarification.
Yeah, and I just want to really briefly add that the URL click-through, so it's a text message, not an app. It's like an SMS simple text message that goes out. It is 130 characters or less, and which includes spaces, punctuations, all of that. And then included in that will be like a little bit.ly link to a landing page that has information about your event. And so that click-through rate is if somebody received your text message and then actually clicked on that link to go look at the more information piece. And so 14 out of 173 families actually clicked and read the information. I'd love to get to a place where we collect information at events and see if families are attending based on hearing about it from Bright by Text. That'd be a cool thing to work towards.
Yeah, that sounds awesome. So for those of you who are not familiar, this is the request form. I will, as always, send out the link for this with our follow-up email so that you can find it easily. And so if you have information that you would like to share, it is free to you. Megan is the one who manages these. So if you have any additional questions about, you know, what's appropriate or anything like that, you can always reach out to us, either to her email or through, you know, or mine or through the coalition email. We will receive it. But yeah, it's a wonderful resource. So please, we urge you to use it.
Yeah, and I just want to also say one last thing about Bright by Text. I think in 2024, one of our goals will be to be more thoughtful about reviewing community calendars and just adding newer events to Bright by Text messaging as we see free community open wide events popping up. And we can reach out and let you know that we plan to do that. But that is a goal, to be more intentional about proactively us finding events that we're sharing out through Bright by Text. And letting you all know, hey, we saw your event on this public, you know, community event page through the library or through the city, or, you know, maybe I saw it on social media. I'd love to push it out through Bright by Text. Is that okay? So you may be hearing from us at the beginning of the year about some of those things.
Yeah, and also just a note that that makes me think, you know, if you would prefer, because I know sometimes, you know, it can get the details get lost, right? And we have many responsibilities for our jobs. You know, when you send in some, you know, you can send things in for the future, because there is a date on it, you know. So if you just want to sit down and send things in that, you know, for the next couple of months, I think that would be that would be fine. Is that Megan, does that sound good to you for people to do? I said it before I asked.
Has been so weird, but yes, 100%. That is great.
Awesome. Yes. So if that's easier for you, you can always just send stuff out way ahead of time, and then just know that it's been done and it'll be shared. Cool. So, and then once again, a reminder about our coalition member agreements. I'll also be sending a link to this in our coalition email. The reason that we are always trying to push our coalition member agreements is really because we want to increase engagement and especially sustainability with your organization's participation in this coalition. We love seeing your faces, and we love having everyone here participate. We want to make sure that if you win the lottery and move on to greener pastures, that whoever replaces you is also going to be attending this coalition, and will also be engaged and participating, so that we can make sure that we're, you know, being, we have some continuity and that we're better serving our communities. So I'll continue to share this out. The coalition member agreement outlines benefits of memberships. It is evidence of commitments. And, you know, it allows you to share that if you have resources available for the coalition to use, if you have specific grant money that you'd like to put towards community literacy, you know, initiatives, if you have board, you know, meeting rooms in places where we don't usually get to meet, you know, anything like that, that we're always willing to, you know, add that to our list of shared resources to make this coalition stronger. We ask that it's signed by an organizational representative like you, the person who comes to attend the meeting, and an organizational leader. That way we know that the organization as a whole is really invested in this coalition and its mission. And I just want to give a shout out to the San Marcos Public Library for being our newest official signed community partner. So yay! And Ashley Schimmelman specifically, but I know that she wasn't able to make it today. And I believe that she sent somebody in her place. If you want to come off mute and say hello if you are here. Not sure if you are.
I don't think Ashley is here.
No, she sent somebody else.
Oh, okay. I'm so sorry.
Yeah, but I can't see all the people, so I'm not sure. But that's okay. But I'm very excited to have a new official community partner. And I know that, you know, we've got Diane Inslee's signature. She knows we exist, right? And that whoever moves on, that we're always going to have some sort of participation from the San Marcos Library, and that they're invested in our coalition and efforts as an organization. So very excited. Are there any questions about Bright by Text or the community member agreements? Awesome. All right, so I'm going to go ahead and open the floor up for community announcements. You know, let us know what you've got going on and feel free to come off mute.
Hello, everybody. So this is more for the Hayes community than Caldwell, but Caldwell is always welcome. Our program is partnering with the Buda Library, and they are having a Touch a Truck event on November 18th, and that is open to the community, and that is at the Buda Library. It's just a cool little activity for kids to actually explore some actual working trucks. Is from my understanding, for them to just kind of sit in there, look at all the cool things that all the gadgets and stuff that are inside, like some of the city trucks and stuff. Anyway, yeah.
Awesome, Mary. Thank you so much. Amanda, I see your hand raised.
Yeah, thank you. You guys may already know about this because it came from our board through community action, but they sent us a flyer about the Core 4 partnership survey that they're wanting to advertise and get out to people for parents with children between the ages of 11 and 24 and youth between the ages of 11 and 24. So they sent us a flyer with a QR code for people to participate in that survey. So I just wanted to see about sharing that with you guys.
Awesome. Thank you so much for bringing that up. Yes, awesome survey. Please share that. I will add that to the follow-up email as well. It's a brief survey. I took it, and it is for people who serve those populations or are parents for those populations. So if you find yourself in that realm, then please be sure you fill out the survey.
Nina, if it's okay, I just wanted to introduce myself. My name is Denise Ferralis, and I'm with the United Way for Greater Austin, but I work out in Williamson County. And Nina and I met because we're both, your coalition and our coalition are in the same place in terms of the Help Me Grow expansion. And so we got to talking and realized that our coalitions had a lot more in common sometimes than the bigger Austin coalitions. And so we've kind of been on each other's radar since then. And I decided to come today just to learn a little bit more about your coalition. And as I've been listening to your meeting, first of all, you guys are doing some wonderful, great things. I'm probably going to steal a couple of things that you've done today for the Wilco Coalition meeting. And Wilco does have a Success by 6 coalition, so it's very similar to what you all are doing, but it is a Success by 6 model. But the other thing I was thinking in terms of like professional development training and some of the other things you guys talked about, we're in the same place. And so if y'all are interested, it might be smart for us to partner and maybe at some point have some sort of joint program where, you know, our coalition and your coalition can get together and benefit from some of the same areas of expertise. So I don't know if you guys would be interested in that, but I just wanted to come off mute and introduce myself and introduce that as a potential idea.
Thank you so much. I think that is a wonderful idea. You know, like I was talking about the needs assessment earlier, that encompasses all of us. You know, it's not specific to just our region. And so those specific needs for workforce development are, yes, I would love to do that. I think that it, you know, creates better participation. I love this collaboration, and yes, and I want to look forward to that. So we will definitely discuss that. Yes. Thank you, Denise. Does anybody have any other announcements? Josue, I know that you, not to call you out, sir, but I know that you came to share some program information today.
Yeah, I just didn't want to interject there. I appreciate getting me out here. My name is Josue Rodriguez. I'm the Special Projects Manager for Workforce Solutions Rural Capital Area. Happy to be a part of this meeting. You guys are doing wonderful work out here, so I would love to aid in that endeavor as well. Some of the duties that I'm responsible for as a Special Projects Manager is running the Summer Earn and Learn program. Now, we service the 9 counties around Austin. And the Summer Earn and Learn program is dedicated to servicing youth ages 14 to 22 that have disabilities, or have a disability, or identify that they do have a disability. And what we do is we get them connected to local community partners. Now, these can be local businesses from your local library, a nonprofit agency, a Gaddy's Pizza, a CVS, a Walgreen, you name it. We're actively getting worksite agreements for them right now, for next year. And we give them an opportunity to earn money during the summer. So they get to get into a position. So for a lot of them, it's going to be their first time work experience, but we give them an opportunity to really develop their character, right? They're kind of, in a sense, used to going to school, given an instruction of what they have to accomplish at their school. And during the summer, especially being that they're so young, they actually have an opportunity to engage at a work experience. They could develop their resume and overall life. Many of our participants, again, being their first time work experience, they'll go into a place not knowing what's going on. But we'll do our due diligence to get them connected to the resources necessary to develop that confidence at the work site. So in partnership with Vocational Rehabilitation Services, we'll get them a work experience trainer, aka a job coach, that will accompany that at the work site to kind of coach them through the nuances of their duties and kind of break into small tasks. But that really builds up their character. And we've had beautiful reviews from our SEAL participants and the parents, saying things like, I can't believe how much they've grown within the 5 weeks that they've done the program. They're eager to wake up early and get to work. Just these beautiful things that they can only be imparted by, community partners getting together and imparting this kind of service. So there are plenty of other initiatives that we have going on throughout the year. Through this coalition meeting, I would love to put that at the forefront with you guys and maybe pick your brains on how we can establish who has what as far as connections and resources, so that we can just dedicate as much of those resources to the people that we impact most in our community. So I look forward to future meetings. If you guys do have any questions, comments, or concerns, feel free to let me know now. I'll also put my email in the chat here, so that if you guys do want to reach out to me later, you can. But I appreciate the platform there, Nina. Thank you, everyone.
You said the 9 counties around Austin. Does that include Wilco?
Amanda, correct me if I'm wrong. I don't believe it does.
Well, you mean Williamson, right?
Yes.
She's
Okay.
That's a shorthand
Gotcha.
for Williamson County, right?
I'm
Okay.
sorry. I'm sorry. I'm so used to everybody knowing what I say. Yes,
Well,
right.
it does include Williamson County, yes. Right?
Okay.
I'm new to Texas, so forgive me on that.
That's okay.
We'll forgive you for being new to Texas.
Yeah, appreciate it. Forgive me. I'm from Nevada.
No, that is wonderful. And Josue and I talked earlier this week, and we were, recognizing slightly different, right, age groups, but when we work with families, we know that it doesn't exist in a vacuum, right? So for to support the family system as a whole, this is a really great opportunity for our programs to get involved. So thank you so much, Josue. I appreciate it.
Oh, most definitely. Thank you.
All right. Anyone else have any comments or announcements that they would like to share before we log off? Awesome, guys. Well, if there's anything that comes to your mind, you're always welcome to email me, and I can add it. If there's anything you'd like to present on, anything that you would like to add to the agenda in upcoming meetings, please feel free to reach out. This is a shared platform, and I want to make sure everybody feels that way. So if you have any comments or questions or need some follow-up, the best way to get in contact with us is going to be through our Start Smart email, which you've been receiving emails from me through. That's going to be startsmarthayescaldwell@communityaction.com. And our next meeting will be January 9th, 2024, 11:30 p.m. to 1 as always. So I think one thing that I did forget to mention when I was going through the slides, and that was part of our planning planning emails is that the time of our meetings is the same. Everyone appreciates a lunch meeting, but the day of our meetings will be changing in 2024. So we'll be moving from this day, we're going to be going to the second Tuesday of the month because that seemed to work better for everybody else. And I will be sending out those meeting invites and information on the location of each meeting in the next month or so, as we sort of define a little bit more locations. But the coalition meetings will be the second Tuesday of every month, not every month, bi-monthly, excuse me, from 11:30 to 1 p.m. And we decided to have the January meeting virtual because I know how I feel at the beginning of January after all the holidays. And so I figure we would do everyone the favor of being able to have the meeting in the comfort of their offices or homes without having to come out to see us just yet. So any other thoughts?
You know, Nina, I just want to throw it out there really quick. I am realizing right now, looking at the calendar, that the second Tuesday of the month at lunchtime is the Hayes County Interagency Meeting. I'm wondering if that's a conflict for any of our folks. It's on my calendar. I don't attend regularly, but just sort of putting it out there. I don't know if that would be a conflict. We can also follow up. I don't know.
Yeah. Okay. Well, I'm glad you noticed that because now's the time to make those amendments. So we will discuss that with our steering committee in December. So I guess TBD, but the next meeting most definitely will be January 9th at that time slot. So we will keep that, you know, just to make sure there's no confusion. But if, you know, there's additional changes after we speak to our steering committee, which will be December 9th, I believe, then we will be sure to let everybody know. Thanks for catching that, Megan. That most definitely is. Awesome, guys. Well, thank you so much for your time today. I appreciate everyone and the work you do so much. Please follow up with us if you have anything that you would like to share or any questions. And y'all have a wonderful rest of your week going into the weekend. Thanks so much. Bye, everyone.